This video is focused on helping that knee extend after a total knee replacement. Now, you can identify if you need some mobility work to enhance knee extension. If your walking is still inefficient and you feel like you're still limping, and the big thing is having trouble extending that knee when you go for that stride. And also a quick check is if you just were to straighten your leg on a table while you sit and you're unable to get the back of your knee down towards the surface. All right, that may be an indication where you need some more mobility work. Now, pain is a huge contributor to lacking mobility. So if this is extremely painful, you might want to focus first on managing pain first. But if your symptoms are predominantly stiffness, where you just feel like it's blocked or restricted, this is the program for you. So again, don't be pushing into this if pain is the most limiting factor. It's mostly if that's that restriction. What we want to do now is induce a long duration stretch to really maximize the effect of the mobilization. So what you can do is take a couple of towels, position it now at the bottom of the ankle, and relax on back. And notice that my ankle being elevated is going to naturally allow gravity to push my knee straight. Now, when I position my knee like this, though, I want to make sure my toes are not deviating outwards. So I want my toes to remain straight up and down. And now I'm just going to relax in this position. I would start with 3 to 5 minutes at a time, building up to 10 minutes as tolerated. I would suggest doing this, especially if knee extension stiffness is a priority or a big limiting factor for you. You need to build up time. It's not about how hard you go, it's really consistency and duration. So I recommend building up to 30 minutes a day if you can, and you can break that up into chunks. But go to tolerance, and based on your soreness and levels, increase the time as you're able to. So if you're really sore, back off the time and allow your body to adjust to it. Now, you can also do this if you were sitting. If you were sitting watching TV, you could also sit in a couch or a recliner, put this under the heel, put your foot on a coffee table, and just allow the knee to straighten out. If your knee is really stiff, you really build up the thickness of this towel as needed to accommodate. But the biggest thing is allowing this to straighten out. If you needed a little bit more pressure, you can put like a textbook or some sort of book or some sort of light weight over the knee. It should be heavy enough where you feel like, okay, I'm getting a little bit of a stretch, but it should not be significantly uncomfortable, because that's just going to result in your muscles guarding and you're not going to get as much out of it. Now, there's an alternative option to this too, which I'm going to show you, which requires you to lay on your stomach. Just another option, another way to do the same thing, and you can pick which one you prefer, and you can mix and match as well. The whole goal is just to get the knee extending. So another way to restore knee extension besides sitting with your knee propped is laying on your stomach with your legs off the edge. Now, this is just another option, so you can pick and choose which option you feel that you respond best to, or it could be situational where you're in a sitting position one time and then you have an opportunity to lay down. So it's nice to mix and match sometimes, and so just another variation. So I'm going to lay down, but my knee is going to be off the edge of the table, and so I want the surface to contact above the incision here. So everything from here down is hanging off, everything from here up is in contact with the surface. So when I lay down, you're going to notice that the contact of the surface and gravity is just going to naturally extend my knee, which is a great passive way to get some extension. So I'm going to spend anywhere from 3 to 5 minutes, building up to 10 minutes as tolerated, trying to achieve about 30 minutes total of accumulative stretching in a day, especially if my knee extension mobility is significantly lost. Some people don't have to spend as much time there because it doesn't require that much time to get fully extended, but others who are dealing with a very stiff knee really have to accumulate that amount of stretch time to regain it, because you don't want to go through a surgery and have a chronically stiff knee after forever. And getting knee extension is really, really important to normalize your walking and to achieve that normal stride. So just go based on how your body's responding to it. If the time is too much, back off a little bit and build up tolerance, because the worst thing that you can do is try to regain motion and then you're creating inflammation, and you'll know that by a significant increase in pain or increased stiffness as a result. So make sure you're dialing it back as needed based on your symptoms.